Hi, everyone. Welcome to our video on home isolation. My name's Emily Rowe. I'm an instructor at Harvard Medical School, an associate physician at Brigham and Women's Hospital, which is in Boston, Massachusetts in the US. And I also work for a nonprofit called Partners in Health, and I'm a senior advisor on our COVID response. So let's talk about home isolation. What is home isolation is the first question we'll talk about. So isolation is literally isolating people. It's separating somebody who is sick with an infectious disease that's contagious from other people who are not infected. And so it's one of our best strategies in public health to stop the spread of disease. So it protects a person's family and community if we're able to separate them or isolate them from people around them who might be at risk for the disease but haven't gotten infected yet. Isolation is related to quarantine. Quarantine is for exposed contacts or people that have been exposed to the disease but do not yet have it. And so that separates sick people or separates people and monitors them to see if they might become sick. So functionally, isolation is just a bit stricter than quarantine because it's higher risk. We know the person is sick with the infection, in this case with COVID-19, and we want to separate them from others to stop that chain of transmission. So contact tracing systems are really set up to identify people who need isolation or who are infected with COVID to protect our communities. So people who are eligible and who should isolate at home, first, isolation is for cases or people diagnosed with COVID-19. So that's really people with a confirmed COVID-19 infection based on a PCR or an antigen test. Or it would also apply to people who've been exposed to COVID-19 and now have symptoms because we would presume that they actually have COVID-19. Home isolation is also for those who don't need clinical care in an inpatient setting. So they're clinically stable, they're able to stay at home, and they can isolate safely and effectively at home. They're able to separate from people in their household, which we will talk more about. People who are vaccinated do need to isolate if they are diagnosed with COVID infection. We know that vaccines are very good at protecting people from infection, but there are a small number of people who can get COVID after being vaccinated. So if they have COVID based on a PCR or an antigen test, they do need to isolate. Somebody might ask you, if they were diagnosed with COVID and finished isolation within the last 90 days, that's an exception where they don't need to isolate. So this is basically because we know that COVID-19 tests can stay positive for a long time after somebody has had COVID and they're not infectious anymore. So anyone who already had COVID, finished isolation within the last 90 days, if for some reason they get another test, they don't need to isolate again. So what's the timeline for home isolation? What does this look like? This simple graph shows you what happens when someone's exposed to and then is infected with COVID. So we know COVID has, that the exposure can occur up to 14 days before the person gets symptoms. So usually someone's exposed between 14 and 3 days before they get symptoms. They start becoming contagious a couple days before they get symptoms, 2 days before symptoms. And then they start isolating as soon as they know they have COVID or they have symptoms. So in this graph, the person starts isolating right away. And then isolation lasts for 10 days after the symptom onset, at least. We'll talk in another video about how do we counsel people when they're done isolating, but isolation lasts for at least 10 days. We might think, what if the person never has symptoms? You know, maybe they got a COVID test because they are traveling, or maybe they were exposed to COVID and that triggered a test. If they never develop symptoms, then we can use that test date to start their isolation. And then it goes 10 days out from the test date. So in conclusion, these are the simple messages from this video. Isolation is for cases as opposed to quarantine, which is for contacts. It starts when the symptoms start, or it starts on the test date if they don't have symptoms. And it lasts at least 10 days after their symptoms start for COVID-19. And in other videos, we'll talk about how to counsel patients on home isolation and how to think about social support for patients who are isolating at home.